One cause of death for adolescent girls across the globe. The positive news, suicide is preventable, but better understanding the risk and equipping family, friends, and coworkers to intervene can save lives. And joining me live are Kelly Posner Gerstenhaber, who created the Columbia Suicide Severity Rating Scale, and Keita Franklin, co-director of the Columbia Lighthouse Project. Ladies, good morning to you. Keita, I want to start with you to talk more about why it's so important right now. I know sometimes in the media we're taught that if we talk about it, it might make it more prevalent. And I've always felt that that wasn't maybe a great way to handle things. What do you think, and how should we be talking about suicide?
Yes, thank you so much for having us this morning. And I know that's a longstanding myth that if we talk about it, that we might in fact give somebody the idea. But what everybody should know, the media and people around the nation, that if you talk about it, you'll actually make a difference. People will know that you care about them and that you're there for them. You know, like you said, it's the 10th leading cause of death in the nation, the second leading cause for young people. And so if we're ever going to make a difference, we have to start talking about it. I know Dr. Posner has done quite a bit of work on reducing stigma, so she likely has something else to share as well.
Yeah, we have to talk about it because we have to break down the barriers of stigma. You know, the biggest cause of suicide is this treatable medical illness called depression, but we don't think of depression like we think of cancer. You would never hear the word choice when it comes to cancer. So this treatable illness, people say, you know, I'm weak if I ask for help. You know, this isn't a real illness. And you know what? That leads up to 75% of people to not get the simple life-saving medicines that they need. So we have to normalize the conversation. You know, if you had asthma, you'd have an inhaler. And that's that. And the other thing to add to what Dr. Franklin said is that, you know, when people are suffering, they want help. And we know that they might not have the will to come to us, so we really have to go to them and treat this like we do everything else, like blood pressure or vision testing.
And Kelly, I think you're the one best, or either one of you best, to talk about the Columbia Suicide Severity Rating Scale. Can you tell us what that is and how can we use that?
Yeah, so the Columbia Protocol are a few simple questions that anybody can use, from janitor to teacher, that helps us figure out who to worry about for the first time. Before, nobody knew who to worry about. They didn't know what questions to ask. They didn't know what to do with the answers. They didn't know if they should ask. So again, a few simple questions tied to next steps that anybody can use. And the thing I want to emphasize is that, you know, 50% of people who die by suicide have seen their primary care doctor the month before they die. Oh, wow. We need to be asking like we monitor for blood pressure, and we have to have that concept well beyond the doctor's office, because many people don't ever get to the doctor. So as Dr. Franklin says, we need to find people where they work, live, and thrive. You know, every teacher, parent, coach should be equipped to ask questions to help save a life.
We're out of time. I wish we had more time to talk, because it is, and we're seeing the numbers go up, especially in our young children right now. We sure do appreciate you joining us. I'd love to have you back sometime so we can talk even more. Love talking to you both. Appreciate you. To learn more about preventing suicide, you're welcome. Go to fox59.com/links. And again, if you need to talk to someone right now, maybe there's a medicine that you need to help you in your brain, literally, call the National Suicide Prevention Lifeline, the number 1-800-273-8255.